I am now pleased to introduce our first speaker, Dr. Daphne Hernandez. Dr. Hernandez is the Lee and Joe Jamal Distinguished Professor and Associate Professor at the University of Texas Health Science Center, Houston. She's a developmental psychologist and examines health disparities resulting from poverty-related issues, with a focus on maternal and child health and low-income Hispanic immigrant families. Her extensive and diverse work gives her a unique perspective on how food insecurity impacts communities. We are so grateful that she's with us today to share her insights. Daphne?
Thank you, Caitlin. So today I will be discussing how food insecurity has impacted communities as a result of COVID-19. I'll briefly talk about, provide a background on food insecurity and how it impacts individuals, the trends, who has been impacted the most in relation to COVID-19, and then I will discuss how COVID-19 has changed how we view food access and food assistance programs, and then end with some strategies on how to reduce food insecurity. As I discuss these topics, I'm hoping that you will see how COVID-19 has highlighted significant disparities. Food insecurity is the lack of access to reliable and consistent access to food for a healthy lifestyle. Why we're so concerned about how food insecurity impacts others is because it has negative implications for children and adults. Specifically, we have observed greater absenteeism among children. These children also experience greater attention and behavioral problems. We know that attention and behavioral problems can lead to academic failure. Academic failure then puts individuals at risk for dropping out of school, and then the cycle of poverty continues. Long-term consequences include less healthy dietary intake, which is associated with higher risk for obesity and diet-sensitive chronic diseases such as diabetes. And these negative health implications have been seen in adults. We've also seen high rates of depression and anxiety among adults. So in the end, food insecurity does have a damaging effect for everyone. As it was just mentioned, the USDA 2018 pre-COVID estimates indicated that 11% of households without children and 14% of households with children experienced food insecurity. I would like to note that this was an all-time low. Unfortunately, now COVID has presented different statistics. 20% of households with children, according to the Brookings Hamilton Project, are experiencing food insecurity, and this is based on a 2-question screener. Then there's work by Dr. Kevin Fitzpatrick and his colleagues at the University of Arkansas, and they used the 10-item USDA scale to estimate that 38% of individuals, regardless of household composition, are experiencing food insecurity. While both of these studies have different items that are using to estimate the rates of food insecurity, both studies are tracking similarly and indicating that food insecurity is on a dramatic rise. To provide you a historical perspective of what the last time we had a dramatic rise in food insecurity, I will refer back to what occurred during the Great Recession. Food insecurity was at 15.8% in 2007, and then started to increase to 2008 as a result of the recession that began in December 2007. The recession technically ended in 2009, and Congress reacted to the economic downturn by passing the 2009 Recovery Act, which increased SNAP benefits between 2010 and 2013. While the increase in SNAP benefits did prevent rates of food insecurity from further escalating, you can see that we maintained at a 20% rate. We did not see a decline until 2015, where we declined the rate to 16.6%. And then it was not until 2018 that we saw food insecurity rates go below the pre-recession rate at 14%. So as we design policies to address food insecurity surges related to COVID-19, we need to take these practices into consideration. Now, we received several great questions from individuals that registered for this webinar, and one of them was, why is there food insecurity in a country as wealthy as the U.S.? I realize it's hard to imagine that children in the U.S. Are living in food insecure households when we consider the number of food establishments that surround us and the number of food-related commercials. In Texas, where I'm located, there are over 43,000 restaurants in Texas, which ranks Texas as the third in the number of restaurants per capita. Therefore, if we have that many restaurants, we have enough food for the United States. So contrary to other nations, the U.S. does not suffer from food shortage or famine. We suffer from income inequality. In other words, poverty is the root cause of food insecurity. While low-income families are impacted by food insecurity, there are also two other types of families that are impacted. Those are the working poor families and families that live paycheck to paycheck. These are families that make too much money and are not eligible for public program participation. These families are unable to meet their basic needs, such as shelter, utilities, food, clothing, and medical care on a month-to-month basis. They do adapt financial managerial strategies to deal with the economic pressure. For example, one month they pay rent and the other they forgo utilities, and the following month they pay utilities but forgo rent. Many times the decision to pay a bill is based on services being cut off. Further, there are some individuals that are impacted by food insecurity in a much greater way. This figure displays that Blacks and Hispanics are impacted by food insecurity more than whites and other races. Blacks and Hispanics are also more likely to work in the service sector industry, such as restaurants and food packing industry, which are now considered hazardous. Their lack of access to care and underlying health conditions among this population places them at greater risk for experiencing infection by COVID-19. I will now discuss how COVID-19 has impacted how we view food access and food assistance programs. When states started to shut down, we started to see some distribution challenges that were more related to hoarding than the lack of food in this country. Consequently, we saw bare food displays. However, this was only temporary, and individuals that still had resources to access food could so during this time. We are now seeing more meals being prepared and consumed at home compared to eating out. While families may be saving more money on meals because they're preparing and consuming their meals at home, they're also spending more on particular items when generic or less expensive brands are not available. We've also observed an uptick on online grocery shopping, which include grocery delivery services and curbside grocery pickup services. Both of these types of services minimize the contact, which lowers the risk of infection. Congress has also responded to the economic downturn and made some changes to food assistance programs. All three programs here that are listed here have seen additional funding being allocated to them to increase program participation. We've also seen the school lunch program restructured so that children can access food. WIC participants are now allowed to enroll or re-enroll in WIC without visiting the clinic in person and postpone certain medical tests. And time limits associated with work requirements have been suspended for SNAP recipients. Now I'll end with some strategies on reducing food insecurity. There have been several proposals laid out on how to increase food access through the SNAP program. Currently, there is a proposal to allow restaurants to accept SNAP benefits. This will provide an opportunity to invest back into the local community, but also provide low-income families to receive meals. This type of mutual benefit attempts to stabilize the economy. Each dollar of SNAP benefits that are spent during a downward economic downturn generates between $1.50 and $1.80 in economic activity. There's also proposals to increase the minimum and maximum SNAP benefit. There's a proposal to increase the minimum SNAP benefit from $16 to $30 and a proposal to increase SNAP maximum benefit by 15%. Increasing minimum and maximum benefits would help families with economic hardship, but also help them prepare for disasters or help them prepare to have enough food in the house in the event that they got sick. For low-income families, it's difficult for them to buy in bulk or at 2 weeks at a time, as they do not have the disposable income to do so. As mentioned earlier, SNAP allotments were increased after the Great Recession from 2010 to 2013. So this recommendation is not unprecedented. There's also a proposal to suspend all SNAP administrative rules that would terminate or cut benefits. I would like to also provide further strategies on what can be done at a national or even local level. Currently, there's not a way to use SWIC or SNAP benefits in online grocery shopping, requiring recipients to physically go in stores. There are 38 million SNAP recipients. This means there's 38 million SNAP recipients walking the aisles, increasing their exposure to coronavirus for a group that has limited access to health care and probably has underlying health conditions. I will note that Texas and other states have recently signed up for a pilot program that would expand the access. Second, I would like to see WIC and SNAP benefits be used towards cleaning supplies and PPE, which is currently not allowed. Cleaning supplies and PPE, which is currently in high demand, may not be something that low-income families have in abundance. We need to consider the needs of these individuals and what we're asking of all individuals in terms of complying to CDC guidelines. Last, there are a couple more things I would like to suggest. My research has indicated that one of the biggest challenges for families is having to decide whether to have gas in their car or food for a week. Many of the low-income individuals are essential workers and are in need of gas and to get to work, but also to attend food distributions to feed their family. Thus, a gas or transportation voucher is recommended. As previously mentioned, SNAP benefit allotments were increased for 3 years after the Great Recession, but we did not see declines in food insecurity until 6 years after the recession ended. Moving forward, SNAP benefit allotments need to be increased. In addition, the increase of allotments need to be maintained for a minimum of 3 years, but perhaps considered 6 based on prior historical trends. After a pandemic subsides, these families will need to continue to receive additional food assistance, as lost wages will put a financial strain on their pocketbook. And last, in January of 2020, the USDA made 2 proposals that should not occur. The first one is a proposal to make it harder for families to qualify for SNAP, and the second one is a proposal where it would make the school lunch program less healthy. Both of these proposals should not occur at a time when families will need these programs and proper nutrition is needed to maintain immunity towards illness. Last, I would like to provide a long-term strategy to reduce food insecurity, and that strategy is a holistic approach to food insecurity, because food insecurity is just not about food, and there's a need to address social determinants. My research, along with others, have indicated that individuals that have difficulty accessing food also have difficulties paying their utilities, rent, and other bills. I would like to see a holistic program that addresses both food and housing insecurity together, as this would be a more effective strategy to reducing both types of hardships simultaneously. I would like to thank the Scholar Strategy Network for helping me prepare for today's talk. If you would like to read more about my policy recommendations, especially about the holistic approach to reducing food insecurity, it can be found on their website. I'm also open to discussion further on the topic of food insecurity with others and how we may collaborate during this time. Thank you.